Hi, I'm Rex. I want to share my story to show how important it is to visit the dentist and get regular checkups. I was unemployed for a while. I really struggled trying to find work. I felt bad about myself. And I didn't see self-care as a priority. Every day felt more and more difficult. I was disconnected from people because I couldn't go to work, and my anxiety kept getting worse. Budgeting was especially hard, and it was almost impossible for me to afford healthy food. I was barely getting by, so I didn't have extra money to get my teeth cleaned or get my eyes checked. My physician was booking months in advance, but I didn't want to get stressed about having to change an appointment if I got a new job. While I was dealing with all of these issues, I didn't even think about visiting a doctor or a dentist. Things started to change when I finally found a job. I was thrilled to be getting benefits for the first time in years. I had to wait for 3 months for my benefits to start, but as soon as I had coverage, I made an appointment with a dental clinic. My visit went really well at first. They understood why it took me so long to make the appointment, and they booked me in for a checkup. I was looking forward to the checkup because I was curious about the soreness in the back of my throat. I was also feeling more tired than usual, but I assumed that was caused by stress and anxiety. I thought my dentist appointment would be fairly straightforward, but pretty soon I was getting biopsies, scans, and treatments. And I ended up needing some speech and eating rehabilitation. I couldn't believe I was finally starting a new job, only to find out I'd be off work and on disability.
My name is Val, and I am a dental assistant. Rex came into our office for his first appointment in a really long time. Once he was booked in, we took a history update and asked him to settle in the dental chair. I spoke with Rex about any concerns he had and told him that I would take some radiographs. Rex mentioned starting a new job, feeling more tired than usual, and having some discomfort in his mouth and throat. He thought he might have a throat infection. During the preliminary exam, I did a full inspection of the mouth, gums, and tongue even before I looked at his teeth. I noticed a flat discolored area on the posterior palate. There was some tenderness over the neck, but no clear adenopathy. I immediately consulted with the dentist, and she confirmed the findings. We sent Rex to an oral surgeon that afternoon for a biopsy. I usually act as the point of contact in these situations. I make phone calls and book appointments with a specialist. Depending on the dental office, I sometimes help oral surgeons remove a mass and assist with operative and post-operative support. I can sterilize our surgical equipment, but on a smaller scale than the people who do this in a large hospital setting.
My name is Kim, and I am a nuclear medicine technologist. After performing a positron emission tomography and a computerized tomography scan, we confirmed Rex's diagnosis of squamous cell carcinoma. This functional imaging technique may be performed as part of the cancer staging process. A PET-CT allows us to detect metabolic or biochemical function of tissues and organs. With a cancer diagnosis, we can see the presence and spread of the disease throughout the body, allowing us to determine if it has metastasized. In cases like Rex's, the patient is injected with a radiopharmaceutical called fluorine 18-FDG or F18. The F18 is a radioactive fluorine that is bound to a glucose analog. The radioactive fluorine will emit radiation as it undergoes decay. The decay is then detected by our PET scanner. The localization of the injected radioactive fluorine depends on the glucose molecule it is bound to. Glucose metabolism is more active in cancerous cells than other normal cells, so increased uptake of the radioactive glucose will be seen in any cancerous tissues throughout the body. A nuclear medicine technologist also performs a CT as part of the imaging study. This allows for precise localization of the metastatic lesions detected on the PET images. Based on the scan result, the oncologist can stage the disease and plan for effective treatment options such as surgery, radiation therapy, or chemotherapy. The patient may return for a follow-up CT scan to monitor the effectiveness of the treatment or address the recurrence of the condition or disease. Nuclear medicine technologists perform many different imaging studies. Using low doses of radiation, we can image many different body organs and diseases. Nuclear medicine is different than most other diagnostic modalities because it can be used to visualize body function and see what's happening at the cellular and molecular level, rather than just the anatomy. There are many types of studies that can be used to image the different body systems: skeletal, cardiovascular, urinary, endocrine, and gastrointestinal are just a few of those systems. In Rex's case, we needed to visualize the body systems related to the throat. We administered a radiopharmaceutical comprised of a radioisotope and a pharmaceutical that localized in the target organ. We also performed image studies for tumors, inflammation, and infection. As Rex's case shows, the cell targeting ability of nuclear and molecular imaging agents can be very effective for treating some types of cancer.
My name is Alice, and I'm a pharmacy assistant. My main job is to mix and measure drugs based on what the patient needs. I also package, label, and dispense medications and check for expiration dates as I do inventory. When necessary, I'll restock medications. I usually perform these tasks in a community pharmacy, but I sometimes work in hospital settings where a pharmacist will double-check my inventory and restock supplies. I work directly with pharmacists who are regulated to prescribe, inject, and counsel on all medications and do a final check on prescriptions. Technicians are allowed to do these final checks too, but pharmacists are always the ones to work on new prescriptions. I work very closely with the pharmacist, especially when we need to get things done as quickly as possible. After Rex's prescription was filled by the pharmacist, I did a final check, then entered Rex's personal data into our system and ensured coverage and billing was correct. I did this processing as quickly as possible as it looked like Rex really needed to get home and rest. Rex went home with a prescription for pain relief and antibiotics following his surgery.
My name is Blair, and I am an oral surgeon. As soon as I saw the lesion in Rex's posterior oropharynx, I was concerned this was an advanced tumor. I did the biopsy in the office right away and put in the request for urgent CT scan with PET scans. While it's important to do imaging for staging, a biopsy was the first priority to determine the tissue type. Unfortunately, the tumor was very vascular, so my dental assistant had to spend extra time with the patient after the procedure. We had to make sure the bleeding stopped and Rex understood our care instructions for the site. I also prescribed antibiotics, since Rex has a known heart murmur and his oral biopsy poses a risk for endocarditis. It can take a long time to get results from pathology, so I marked the biopsy as urgent. I also asked the staff to call the lab if we didn't have the results back within 72 hours. When the staff called the lab, they were told that the sample had to be sent for special stains and that it could take a week to get the results back. I thought this was unusual, so I called the pathologist myself. He was able to give me the preliminary report, which indicated that the tumor was definitely malignant, but the exact cell type was still unknown. Even though we didn't know the cell type, the confirmed diagnosis allowed me to proceed with the correct imaging and treat the case as urgent. We would still need a CT if the tumor was benign, but it wouldn't have been urgent, and the PET could have waited. Fortunately, we received all of the results within 2 weeks. The squamous cell tumor in Rex's mouth was not metastatic, so we arranged a full resection in the operating room. We will give Rex some post-op radiation to reduce the risk of local recurrence.
As you can see, I interacted with many different health professions along my journey. It is great to see how these professions work together to ensure I get the best care possible.